Life as a resident at Beaumont is exciting, it's challenging, but I think it's also very rewarding.
It takes dedication, it takes compassion, it takes hard work, it takes teamwork.
I really like Beaumont in terms of a hospital, but also as a residency program. I feel it's been a really great place for me to grow as a physician.
Beaumont Royal Oak has grown tremendously from a little 250-bed community hospital that was born in the 1950s to what it is today. It's a 1,200-bed tertiary care hospital that has virtually every imaginable service.
There's not a test or a study here that I can think of that I can't order if I need it for my patient. Basically everything that I need to take care of my patient, to figure out what's going on with them or to treat them, it's available.
I chose Beaumont because it was a community hospital and a tertiary care center and a large academic center. Very good reputation of turning out great surgical residents.
We have a wide array of residency and fellowships, approaching 40 in total, and we span the gamut of specialties from internal medicine to the most complex of surgery.
It is a big hospital, and that means that we see a lot of different patient populations. We see people of different ethnicities. That means we see more disease processes that affect those different groups.
We get patients from all over. We get patients from rural areas, urban and suburban communities. You know, you'll see all sorts of cultures and education levels and socioeconomic status.
We do a lot of pediatric cases, elderly cases, routine cases, cases that are outpatient, inpatient, and at high volumes and fast pace.
At Beaumont, we are looking for those that want to be superb clinicians and a difference maker in medicine. The role of the resident at Beaumont Health is to be an integral part of the care team.
We want people who are passionate and idealistic about making a difference in their career, and our residents clearly exemplify that. We want people who don't settle for the superficial answer, never cut a corner.
A resident who is eager to learn, who definitely has the academic qualifications, but also has the ability to empathize with patients and be able to build rapport with patients on a deeper level.
One of the great advantages of doing a residency or fellowship program at Beaumont is that you're going to work with clinicians who are doers. Many of them are in private practice, and they actively see patients on a regular basis. They have great people skills. They know how to interact with patients. They know how to be able to take care of their needs in their most dire times. And we also have the full-time faculty who also have great clinical skills, but they have the time to be able to spend with the residents and fellows to be able to give the educational and research experience that they need and deserve.
The attendings here are wonderful. You can tell they really have a vested interest in you, and they'll work one-on-one with you. They depend on you. I think there's a mutual respect. They want you to learn, they want you to succeed.
I think we have a good mix of, like older experienced attendings, new attendings. There's a good mix of different hospitals, so you kind of get a different perspective on how people practice.
What's awesome about our program here is that as I develop my skills, the attendings are very good at being able to decide when I need help and when I don't need help, to give me the autonomy I need within my own skill set, but also they're always right there. Beaumont is affiliated with Oakland University. For me, that means that I get to work with students. I get to have students as a second and third year kind of follow me and shadow with me, work with me, which keeps me on my toes.
Here at Beaumont Health, the environment is one of strong, close relations between the attending faculty and the residents and fellows. It's one of inquiry in which we expect you to ask questions. We expect you to question even your faculty. Why is this being done that way? And for the answer to be evidence-based, to be based on the research that's out there.
Our residents are tremendous. They're some of the smartest people you'll ever meet. And they're so fun to work with. the sorts of questions that they come up with in the clinic, are often drive our research endeavors. They come up with ideas, and if the answer's not in the literature, it's a research question.
We have just within this Royal Oak campus a 5-story Beaumont Research Institute building that is comprised of, first of all, the state-of-the-art equipment that rivals many university academic medical centers, but also has a large number of human resources of biostatisticians, research methodologists, grant writers who are available to the residents on a full-time basis to help them to advance their own research.
Every faculty member is involved in some sort of project, so it's very easy for a resident to either come up with their own project or join an existing project. And Beaumont Health as a whole supports research a great deal, so they provide a lot of funding.
I think the diversity and complexity of the cases lends itself nicely for research opportunity. The residents are financially supported to present their work at many national conferences.
Our residents have the opportunity to participate in the Surgical Learning Center. In the Learning Center, we have times when the residents can come on their own and work and practice suturing and knot tying.
I must admit, I have never seen anything close to our simulation center at Beaumont. It is cutting edge and provides not only internal medicine, but also surgical residents and fellows a unique experience to be able to have real life simulation of very complex cases.
One of the distinct advantages we have here is that we have an exceptional team approach to the clinical care and education of our residents and our fellows. And this involves not just the attendings, but the nurses, the clerks, our social workers, and all other people who work within our department.
The thing that drew me to Beaumont most was probably the way that people interacted. It's really a collaborative, supportive environment.
As a resident here, I was able to grow personally and professionally, but always felt supported by the program director, by the faculty.
Everyone's friendly. No one's trying to outgun anyone else or make anyone else look bad. We're all friends in the hospital and outside of the hospital. We get together.
Beaumont's in Royal Oak. Indeed, the suburbs of Metro Detroit are very prosperous oftentimes. There's a lot happening, a lot going on.
I've lived in Detroit for about 6 years now. It's a really vibrant, very exciting city to live in. It's kind of on a resurgence right now with new restaurants, new events. So if you want to be a resident at Beaumont and still have that urban lifestyle, it's definitely easily possible.
If you're a sports fan, this is a great city for you. You have the Lions, the Tigers, the Red Wings, as well as the Pistons. If you like the arts, the DIA is a world-renowned institution. There's the Detroit Symphony Orchestra, which has amazing programming. The downtown area is quite beautiful, and then within the larger state of Michigan, if you're an outdoors person, we have metro parks, very nice green spaces.
On a resident's salary, it's actually a very affordable place to live. I mean, there's lots of different condos, apartments that you could live in.
Beaumont has housing, townhomes right next to the campus so people can walk to work.
Life as a resident at Beaumont is really excellent. There's a great balance between family life and work life. You get to work hard, see a lot, and learn a lot.
I think life as a Beaumont resident is fulfilling. It's busy, we work hard, but at the same time, it's a great experience.
If you want the whole package where you want to be a part of an academic setting, but still know that you're going to get a one-on-one education, then you can really have it all. And I think that Beaumont will provide that.
Residency's hard, but there's going to be days that when you leave, you're like, wow, I'm a doctor. I did that. I fixed that. And people depend on you.